Vats, or video-assisted thoracoscopic surgery, is a minimally invasive surgical technique that cardiothoracic surgeons use for surgery within the chest. It's essentially keyhole surgery for the chest. During the procedure, a camera and surgical instruments are inserted through the chest wall through tiny cuts in the chest wall. The scope then transmits high-clarity images from within the chest onto screens in the theatre, guiding your surgeon throughout the procedure. The main benefits of this type of surgery is that because the cuts are so small and there is no rib spreading, there is a significant reduction in pain, reduction in surgical trauma, reduction in complication rates, and there is also a more rapid recovery. This versus the traditional technique of spreading the ribs with a larger incision. Vats can be performed to do most lung and thoracic surgical procedures. These include lung biopsy, lung resection for lung cancer, and pleurodesis, to name a few. We have 5 lobes of the lung, 3 on the right and 2 on the left. And when surgeons remove a lobe of the lung, this is called a lobectomy. This is commonly performed for early stage lung cancer. We also use it for a pneumonectomy, which is a procedure that involves removing the whole lung, usually due to a tumour in the major airway. It may also be used to treat a collapsed lung or pneumothorax, to evaluate tumours, or for a bulectomy, which removes a dilated airspace from the lung. Vats is also used to treat asbestos-related diseases such as mesothelioma, for esophageal surgery, for hiatus hernia repair, and for thymus gland removal surgery or thymectomy. In early stage lung cancer, Vats lobectomy has excellent 5-year survival rates and freedom from disease. This makes it the surgery of choice for early stage lung cancers. Although the recovery is faster and easier than regular open chest procedures, there are still some potential risks with Vats, which include air leak from the lung that occasionally requires additional treatment or longer hospital stay. Less than 1 to 2% of patients may require conversion to a larger cut with a traditional rib spreading for various reasons, including bleeding, and there are also standard risks relating to having an anaesthetic. Less serious complications include pain in the chest wall or shoulder for a few days to weeks post-procedure, although this usually resolves in a few days. Complications are generally less than with open chest surgery. Generally, the outcomes for Vats lobectomy for early stage lung cancer are excellent, and certainly there are multiple studies at the moment looking at the comparison between open surgery and videoscopic surgery. With all the current evidence that we have, we see that Vats surgery is equal, if not better, to open surgery, particularly for early stage lung cancer.